Am I in it?
This way, a little bit left. All right, yep.
Okay. What's the most complex part of the human body? The brain, of course. But sadly, there's one disease that slowly destroys that: Alzheimer's. Alzheimer's is a disease that over the course of time degenerates the brains in the cells in the brain that affect memory and then leads to the loss of several other mental functions. To begin explaining this complicated disease, I'll first talk about the discovery and research from the past, then the patients and families it affects and the stages, and go on to possible treatments and cures. Let's start with the basics of Alzheimer's. In order to do that, we need to know who discovered it and how he discovered it. Dr. Alois Alzheimer's, clear back in 1906 when it was first known. Alois Alzheimer, according to biography.com, Alois was a German psychiatrist and neuropathologist. He worked in a hospital and started to notice the memory loss from many of his patients. He then investigated the nervous system a little bit more, which led to the discovery that the cerebral cortex shrinking, nerves tangling, and plaques between nerves was the cause of all the memory loss. And then there's some pictures to describe the cause. And then his first patient was Auguste Dieter. She was 51 when Alois first met her, and she had strange behavior symptoms and increasing memory loss. But Alois wasn't able to spend much time with her because she died 5 years later at the age of 56. She was the very first person diagnosed with Alzheimer's. Before she died, she said to Alois, "I seem to have lost myself." The reason for her losing herself was because the cerebral cortex doesn't just affect the memory of who people are, but the loss of knowing how to do everyday things. The brain has multiple functions, and Alzheimer's doesn't affect just one side of the brain, it affects both. Here's a picture of the brain. On the left side is more of your logical and language, and on the right is your creativity and imagination. Without these things, you slowly become someone you're not. Okay. Which leads us to the next topic of the effects it has on patients and their families. So here's a video of the effects it has on patients. Here are a few facts about the Alzheimer's epidemic. More than 5 million Americans are living with this disease. Alzheimer's is the 6th leading cause of death in the United States. One in 3 seniors dies because of Alzheimer's or another dementia. It kills more than breast and prostate cancer combined. And then the next is a picture or a video of the effects it has on the patient's families. On average, it costs $5,000 to care for someone with Alzheimer's. For some, this may mean not going on family vacations, and for others, it may mean going hungry. Alzheimer's isn't a disease where you just wake up one day and have it. It's a progressive disease. The Alzheimer's Association has done studies for years and concluded that it has 3 main stages. The first stage is mild, lasts for about 9 years, and the symptoms are short-term memory loss, problems reading, and loss of sense of direction. The next stage is mild, or moderate, which lasts for 2 years, and the symptoms are poor judgment and short attention span. The last stage is the severe, which has all these other symptoms as well as loss of vision. And as you can see, as Alzheimer's progresses, it slowly takes over the brain. Usually the cause of death from Alzheimer's is heart or kidney failure, as well as strokes, or even the immune system weakens and causes infections. Here's some pictures to show how big of an impact Alzheimer's has on the brain. The picture on the left is comparing the size of a healthy versus normal, or a healthy versus one with the disease, and on the right is the activity of the brain. With all these problems and symptoms from Alzheimer's, you think there has to be a cure. Unfortunately, there are no cures, but there are several treatments. In 1987, the first drug trial was done on the drug Tacrin, and it was used to target the symptoms. In 1933, the first drug was approved by the FDA, the same drug Tacrin, which was tested 6 years earlier. Since then, there are several other drugs that were tested and approved. Here are the drugs, the stages of Alzheimer's they're used to treat, and the date they were approved. There are also treatments related to drugs such as herbal mixtures, exercise, and eating healthy. Even though these are all possible treatments, there is still no set cure, but many studies and tests are in the process to change that soon. One study is a case a college did on mice. In the International Business Times magazine, the University of Manchester gave mice an anti-inflammatory and saw the reversal of memory loss. But there's still some fine-tuning to do before they give it to patients because mice and humans aren't exactly the same. So through this presentation, I've talked about Alois and how he discovered Alzheimer's, the effects it had on patients in the 3 stages, as well as possible cures and treatments. I hope you've all learned a little bit more about Alzheimer's than you did before.
You're out. You got it. Yay.
No, she's not.